Good afternoon, everybody. My name is Nadine Grainig. Guatsi, Hinome Suchietza. I'm a member of the Pueblo of Laguna in New Mexico. And welcome to Indigenous Perspectives. This is our part 2 of traditional knowledge in health and wellness. So I hope you got a chance to see the first one. If not, we can definitely send you the link, or just go on Save Our Schools Arizona Network at sosaznetwork.org, and you can actually find all of the recordings there from the Indigenous Perspective series. So just a little bit about me, other than where I come from. I have been in Indian education for almost 20 years now, and I spent almost 18 years at the Arizona Department of Education. And my last position there was the Director of Indian Education. I've also been in the nonprofit world for 15 years or so. And I founded my own organization in 2007. But last year in June, I started Sun Clan Consulting. So it's my own small business. So that's a little bit about me. Now I'm going to reintroduce you to Dr. Luanna Rodriguez from last week. She's a certified nurse midwife with over 30 years experience in the public, private, and federal sectors. She is actively engaged in culturally sensitive and trauma-informed care practices to support resilience in women of color affected by historical and societal oppression and trauma, with a special focus on the health issues of Native women. Dr. Rodriguez has been certified as an adverse childhood experience trainer, part math trainer, and a certified clinical trauma professional to provide guidance for clinicians and community partners in translating the ACE's foundational research into trauma-sensitive practice. Her vision is to help destigmatize the effects of trauma, support self-determination in the health of Native women, and break the cycle of transgenerational trauma on future generations. Dr. Rodriguez's latest venture is being executive director and founder of Body and Soul Sovereignty Unite. So welcome back, Dr. Rodriguez.
Thank you, Nadine. It's good to be back.
You're welcome. I was telling her before we started, she's our one consistent panelist for this series. So you can see all of the women that we have had on the panel and have today are very busy women, and in the health care field, of course, things come up. So I'm very grateful to add to our panel today Dr. Stephanie Bigcrow. Dr. Bigcrow is Oglala Lakota. She holds a doctorate of business administration in healthcare management and leadership from California Intercontinental University in Irvine, California. And she has a master's degree in education from Northern Arizona University. Of course, that's in Flagstaff. She also earned a certificate from the Global Leadership School for Indigenous Women, Indigenous Peoples' Rights Program at Columbia University in New York City, where she is the regional academic advisor for North America, Arctic, Pacific regions for the Institute for the Study of Human Rights. Dr. Bigcrow is also a cultural advisor and consultant for Lakota Biobank, located on the Cheyenne River Sioux Tribe, South Dakota. She assists in development of tribal resolutions aiming at safeguarding legal protections of Lakota biogenics, regulating research on tribal members and tribal lands using Indigenous research methodologies. I could go on the whole session on her credentials, but in addition to her many academic and professional achievements, Dr. Bigcrow is an accomplished athlete, activist, volunteer, and a wonderful friend, and so much more. Didn't even mention the family. So welcome, Dr. Bigcrow.
Thank you, Mashke and Nadine, for allowing me this opportunity and share this space. It's been an honor, and I look forward to our conversation.
Great. So do I. I'm excited. So our next new panel member, literally, I learned her name about half an hour ago. Her name is Anjali. I'm supposed to say it like the French, right? Dr. Anjali Lafleur. We were joking a little bit because she doesn't say it that way, but I do because I lived in France. So, ooh la la, right? Anjali is a mom, sister, tia, comadre, psychologist, hypnotherapist, womb-to-womb dual. Is that how you say that?
Doula.
Doula. Oh, it's misspelled. It's a typo. I knew that wasn't right. Doula. And business owner. Originally from Southern California, she is Afro-Cuban. Is that Taino and Arawak?
Yes, Taino.
Taino and Arawak. and Guatemalan, Maya. As a former faculty, developer, and professor specializing in the psychology of gender and culture, her degrees from Arizona State University and the University of Southern California were in counseling psychology with an emphasis in multiculturalism. Dr. Lafleur's passion for diversity resulted in her teaching in Tanzania, Africa, 2004, on the prevention of HIV/AIDS, malaria, and other culturally bound practices. Additionally, in 2007, Anjali became a certified hypnotherapist and in 2014 received training in mindfulness and biofeedback in New Mexico State University. Since transitioning out of academia, Anjali is incorporating her varied experiences within the nonprofit sector. Given both her business and educational background, she is now focusing on her role as the co-founder and the COO/CFO for the SIWAP. I probably said it right the first time. SIWAP Collective, a nonprofit organization that supports families to reconnect with ancestral knowledge. As a bilingual professional, Dr. Lafleur is a regular contributor to podcasts, called on for speaking engagements such as this one, and as consultant, providing leadership and counsel to a variety of boards and organizations. Her most recent writing has been included in the book titled Beyond the Surface of Restorative Practices, Building a Culture of Equity, Connection, and Healing. So welcome.
Thank you so much. It's always so interesting to have your bio be read. So thank you for saying my name better than my parents even intended. And I'm happy to join all of you today.
Well, it's great to have you all here. So if any of you would like to say a little bit more about yourself, can I go with first names?
Sure.
Okay, Luanna, would you like to say a little more about yourself?
I think you've said everything.
Okay.
And I'm also Boricua, which is Taino as well.
Oh, okay. So you guys are relatives.
The island of Puerto Rico.
Yeah.
Great. All right. Stephanie, would you like to add anything? Like I said, you may say something about your family, since I deliberately left that out.
Yeah, no, well, one, it's fascinating to meet two Tainos. I visited the lands and seen the ceremonies, beautifully strong people. So I know, Luanna, that you were, Lua, you were that nation. So welcome. But no, yeah, Nadine, I just want to briefly mention that, so I come from the Big Crow and the Little Hawk Tioshpais, which are under the Oglala Lakota Nation. We are the Teton under the Ocheti Shakome. So it's always customary for us to introduce ourselves in our Lakota language. And I'll make it brief. So, Hamatakuyapi, Stephanie Kangi Tanka Imachiape, Mi Tioshpai, Metawaki, Oglala Lakota Hamachialo, Meneluza Ha Antama He Awa Tipi, South Dakota Pine Ridge Indian Reservation, Una Tipi. So just introduce myself, my family, where we come from, and our lineage of being a part of the Teton, the Oglala Lakota Nation. So thank you, Nadine.
You're welcome. Anjali?
Yeah, I think I'll just add, I'll explain what Siwapatli means. So Siwapatli is a Nahuatl word, and it means women's medicine. So the collective was founded 6 years ago now, and we focus on supporting Indigenous families from womb to tomb through a variety of ways, but that includes cultural restoration, birth equity, reproductive justice, and food justice work. Just to briefly explain, the work of the collective. We're based here out of Phoenix, Arizona.
Okay, did I read that right? Did it say womb to tomb, or did I read womb to womb? I can't remember.
Either way, we fixed it right now. So are they, we're going to travel back in space, So it's fine.
Well, I have a bachelor's degree in English, and I hate to mess up. All right, so let's get started. We've got less than an hour now. So Luanna, last time you provided some informational text for our session, and thank you for that. So in part, it states that Native women are 2 to 3 times more likely to experience poor maternal and infant outcomes than Caucasian women in the United States, and that they experience a higher rate of hypertensive disorders and obstetrical hemorrhage that is more than twice that of Caucasian women. To what do you attribute these circumstances?
Well, Nadine, the factors that drive disparities in maternal health are very complex, but I'll start with this. What history tells us about the abuse and the attempts to eradicate the indigenous population by colonialists has created a deep-rooted trauma that has spanned generations. I feel that this history was the beginning of what contributes to health disparities in Native women today. The higher rates of hypertension and obstetrical hemorrhage in Native women have been associated with a number of factors. The first being the long-term effects of history, followed by the current social determinants of health, in addition to having to deal with implicit biases, racism, and gender oppression in healthcare. So when a pregnant woman carries the burden of many lifetimes of trauma on her back, including her own, it changes her physiology. When she presents to the hospital in labor, to then be at risk for obstetric violence by hospital staff, such as being shouted at, scolded, ignored, or refused help just because she's Native, it's like a perfect storm waiting to happen. However, we know that Native women stand out by having the highest risk of hemorrhage than any other groups, despite knowing that the underlying trauma can be a contributing factor. The actual specifics of the physiological changes that take place in Native women and put them at risk for hemorrhage is still really unknown in the literature. So there's not much to say about those, the hypertension itself, we know, but the coagulopathy that may happen, the changes in the clotting factors, they still don't know in the literature.
Well, so one of the things that needs to be done, of course, is to get it into the literature,
Yeah.
to train all healthcare professionals about historical trauma that is passed on through generations and has a physiological and spiritual and mental impact on on Indigenous patients.
Mm-hmm. Correct.
Did either of you want to weigh in on that before we move on to the next question?
Actually, yeah, sure. I feel like I can always add on something. Yes, absolutely. We want to study and understand and talk about, as we're doing now, the impact of historical trauma, but then also remember too that, that resilience is also inherited, and that ability to overcome and to be able to work together, right, to solve these problems is also inherited. But yes, and that's in no way to kind of either sugarcoat or like go in the opposite direction. I just always want to remind us, right, because it's so easy, because of trauma, it is so easy to focus on the negative aspect or the problem, right? But we know we want to like train our brain, right? Make those connections in our brain so we can also recognize the good. I think the other part too that is challenging that we know about trauma is that response and reaction can also be passed on, right? So that's all, it's not only the birthing person, right? It's also the concern about how the DNA is shifting for their children and their offspring. Again, there are things we can do, right? All of the ways that we live help us change that. But it would be ideal. Who could we be, right? What would we be if we didn't have to overcome trauma at birth?
Mm-hmm.
No kidding. Or as we grow up. So yeah, you're exactly right. You have to kind of couple the good with the negative. And of course, my realm is education, and so I do presentations on historical trauma and resiliency to show that. So if we do overcome, but obviously we want to get better at mitigating some of these stats. So Stephanie, did you want to weigh in on this question?
Yes, definitely. It's so interesting how the dynamics play out here, and how when we talk about these social determinants of health and how they relate to just the vulnerability of our Indigenous peoples regardless of where they live. one of the studies that I had, I was able to really kind of gain an outside perspective was done by Harvard University back in 2015 and 16. And unfortunately, it didn't receive funding, but there was a preliminary review to see if this form of study was even possible to conduct within the Lakota Nation, within the Plains. And it looked at, it centered its focus on genomics and knowing that specifically that vulnerable populations suffer from high health disparities, and a lot of them are very preventable, such as diabetes or cardiovascular disease. Some may be inherited, but others can be potentially prevented. So we looked at the impact of how our, if there was feasibility incorporating spirituality or a religion, and I don't want to use the term religious because there's and I only speak for my nation, right? That our way of life is not a religious way of life. It is actually a spiritual way of being. And so we looked at how this spirituality metrics that could be gathered from participants through surveys that could be looked at as determining what factors are, were relating to a lot of these high stress levels, these ongoing increasing health disparities that are uncontrolled, that are taking literally the lives of my people weekly. We have so many of our members that transition back into the spirit world on a weekly basis that I think it's almost made my tribe somewhat numb to that, to death. And so when you add it in that, when this added contextual data, looking at incorporating what is that spirituality matrix and what does that look like, and as it is associated with lowering stress levels. Well, one of the things that came out of that, which was an interesting dialogue as well, was that looking at the process of DNA methylation. And so when we associate the methylation process, right? And this happens from birth. And it's interesting because I always think to myself, so we inherit this trauma, we are born into it intergenerationally. It is transferred. We know this, that the genetic expressions of our ancestors were changed from, since first encounters. But now as we're looking at, what is this cognitive state today and how the transference of intergenerational trauma, which epigenetics can be looked at in terms of the DNA or the methylation process that indeed occurs at a very young age. So, and that in itself, an individual's methylation process, and I'm always confusing the word, but it actually is the core to the development, the neurological, which involves, which impacts the psychological, which provides the mental stability and the outlook of an individual, but the immune system as well. And so when that process is where where an individual's genetic growth are, which I call it, goes from a good methylization process into a demethylization process. What it's doing is it's actually it's remaining dormant, so it does not help the body physiologically develop in those areas necessary, such as the neurological, the immune system, to understand and even identify other gene expressions that could possibly trigger or be cancerous. And so the body is just amazing. And now as we're looking at health disparities in these vulnerable populations, we have to look further and beyond Western science and back into some of the traditional knowledge that we know as Indigenous peoples, especially relating to the birth of these sacred Wakanja. So a lot, but definitely wanted to just bring that to the forefront. Thank you.
No, I appreciate that. Thank you. It's very, very interesting. And obviously an hour is not enough time to really get in depth into any of that. And by the way, if anybody has any questions, please feel free to put your questions into the chat. So we're talking about vulnerable populations, and that brought to mind foster children, maybe adopted children. Indian Child Welfare Act is something that's been controversial, especially lately. There's the concern of Indigenous children being adopted by non-Indigenous families. So I would wonder if there's any data about those children. Are they tracked at all? That's just something, I don't know if you guys have any knowledge of that. It's just something that just occurred to me. But specifically to foster care children, to your knowledge, are women who've grown up in the foster care system more likely to be at risk for adverse health conditions as than those who have not, or maybe adopted children? I was going to ask Frederica Hunter this question, but she wasn't able to join us because I think she has worked in the foster care system. So if you don't know, we can move on.
Now, I do have, I don't know if Anjali, if you want to respond from a psychological.
So no, I do not have any experience specifically in the foster care system, but just thinking about in general, kind of separation from family, separation from our parents, even if that situation was difficult, even if it was abusive, right? Even if there was something negative going on there, that still is going to carry, very difficult experiences that we have to assimilate as a child, that maybe we don't have the capacity to be able to make sense of everything. And then going into assuming, there's just there are wonderful foster parents, and then there are situations that are not wonderful as well. And so if somebody continues to go into these scenarios and these situations where they're not taken care of, that's only going to worsen and exacerbate. And then the issue, which is what all three of us are talking about, right? The issue is the way that our bodies are going to store this memory and this trauma, right? That's going to potentially make us more, have a higher propensity, right, for long-term illness, and also illnesses that can manifest or display when we're in the time of childbirth. So let me talk about this really fast. One of the most challenging things about the time, around the time that we're birthing, is that we do not have control. And whenever anyone is going through the process of transition, any time in our life when we have experienced some level of abuse where we didn't have control, many times those memories are triggered. And so that happens, that's not only at birth, right? But that is a market time at birth. That was some of my dissertation, some of the work that I did. It was on mothers who used hypnosis to birth. And many of them chose that because they knew that they had some trauma in their background and they needed to work through that. So this is a roundabout way to kind of say, just coming from a tough situation, there's likely, most of us don't come from a tough situation and have a bunch of other positive experiences. It's usually negative experiences, and we're going to carry those forward with us.
Thank you so much.
Yeah, and so I can add to that. So I do have experience working in the foster care system in South Dakota, and this has literally been an ongoing issue for my tribe for generations. It's basically, there's a dollar, there's a price tag attached to every Indian child's back. And knowing that the state makes money and they look at us as just a profitable gain by exploiting us through state systems, through oppressive through oppressive systems as the foster care system. It is such a inhumane act, an atrocity that is that really has created such and intensifies the historical trauma that we already inherit genetically and as we make our way into Mother Earth. And so when I looked at the foster care system and I started my research during my undergrad, attending my tribal college, Oglala Lakota College, it was very sad because there were a part of our undergraduate course was to do this participatory action research project. And so half the class was divided, and each one half wanted to address the racism, just the systemic racism in South Dakota. And the other half wanted to address, what's being done about our children, that 2/3 of the children in the foster care system in South Dakota are Lakota. And that's a high number.
Very high.
And for us, it was very concerning. And so so half the class just divided. And it ended up being that we did complete our CAP project. We were able to actually partner. My granddaughter, sorry, all these little fruit flies. My granddaughter loves her fruit. So she obviously left some out somewhere. But so it ended up resulting in a beautiful project where we were able to continue it for 8 years after we had completed the CAP project, like the capstone project. And what we did was we actually merged. So we acted as these just advocates, cultural advocates, and volunteering in these non-Indigenous systems, such as the Black Hills Children's Home Society, the CASA, program for poor-born special advocates, and just foster parents. So we were able to go in and just provide these parents culturally tailored and meaningful training in how to approach our Lakota youth. Our elders have been doing this within our systems. They do it with the Rapid City Police Department, with CASA. So these are things that are extremely vital. And we know that we're up against a system, and we've been continually combating that system, just trying to influence and really get the state to acknowledge the biological impact of intergenerational trauma, epigenetics, and how that has really led to the state, in which the state that we are today as a people. But the only commonality that we have is truly the identity, the cultural, continuity, the ability to sustain and maintain these traditional life ways of living, of being from a Lakota and in a rural Lakota perspective. So that's one of the things that we share. And I'm actually starting that back up now that I've relocated back to South Dakota, where we will be kicking off just a forum in the spring to look at developing and designing a urban Indigenous women's tioshpai, that would provide that guidance and that traditional knowledge and the cultural resources for our Lakota youth. And previously we had done it through hosting an annual powwow several weeks before the holidays. And during that time, we would bring in our traditional healers, our practitioners, our elders, and we would actually do a blessing over these young children. But there's a fine line too, because Privacy Act, HIPAA, you have these. So it was just an open invite. But we would bring in all key actors and contributors, including state agents. And we had a lot of pushback at first, but it took a few years. And they seemed that we were merely there to, one, acknowledge our Lakota youth. We felt early intervention was the key. So we provided ceremony. We actually did we provided blessings. We gave them Lakota names. We explained to them what those names mean and how we use them and how they guide us throughout our life journey here on Mother Earth. And we also did the wiping of the tears to tell them that at one point in their life, their grief will stop. And when it does, that we recognize them as they are our future. And that although they may not know us, we know them. And that we're sorry that they're held up in this system, but we've never forgotten about them, that we acknowledge them, that they are Lakota, they are part of our tioshpai. And that when they, whatever should happen, that when they walk their life journey to come home, that we would welcome them and that we will continue to teach them. And so that they understand the importance of what it means to be Lakota, and that because that cultural duality and just the identity crisis that we're going through now, COVID really triggered that. And so when we know how important as Indigenous, and I think all of us in this group, how important it is that, our identities are literally our foundation. They sustain us in every which way. So just wanted to share that.
That's definitely part of the mission of Sun Clan Consulting. And it's been part of the mission of all the jobs that I've had. in Indian education is to help our children get that good, strong sense of who they are, strong sense of identity and self-worth. And it's amazing the work that you did. I'm sure that went a long way to help these kids. And I
It was
commend
such an honor. Yeah, it's moving.
you.
Yeah, it's definitely, and it's something that I think we can do here in the Phoenix area. Who knows?
Of course, it can be done anywhere.
Yeah.
And so that reminds me, I'm going to skip ahead a little bit. Of one of the questions that I had was about self-determination. So you took the determination that you and your fellow your colleagues had, fellows doctoral students, took it beyond your education and into for many years and did this kind of work. How would you define self-determination in terms of a woman advocating for herself in terms of healthcare?
Are you referring to me?
I was gonna say all three of us, I know.
All three of you, yeah.
answers,
Luanna,
so-
you haven't spoken for a while. Let's have you respond first to that one.
Okay, well, it's the process by which a person controls every aspect of their own life. In women's health, it involves the rights of women to learn about their health, to make informed decisions, and to change the course of their healthcare to their satisfaction. It gives them personal sovereignty. That's what it's all about.
Great definition.
Mhm.
And you remind me of my mother when, of her generation. They would never question a doctor. They just did what they were told, what the doctor told them to do. And of course, the doctor was usually a man, always a man, I should say. And I remember my first experience with a gynecologist was terrible. She took me to her doctor, and I was always squeamish as a kid. Not anymore. I've been through enough health issues now. It's like, but they had these pamphlets, on the coffee table in the waiting room, and I was looking at them, and I just started to feel really faint. I felt get cold and clammy, like I was going to faint because I didn't know what these things were going to be doing to me. And he made fun of me. He actually made fun of me.
Oh,
And of course, I never went back to him, but that was my first experience. And my mother didn't say anything either, because it's just not what you did back then. So now we're talking about a lot of, what's passed on through birth and through maternity. We're talking about maternity, being pregnant, giving birth, what happens, during that time. What would you say are the three most important things a woman can do or not do when she finds out she's pregnant? Anjali.
Sure. Well, I'm going to give an example, if I may, regarding what self-determination.
Oh, sure.
Like,
Sure, of course.
and I'll try to weave this in as well. So when I want to just talk about the work of the collective, right? The Siwa Batley Collective. We've been working really hard to make the link between both birth equity and reproductive justice, along with food justice. And on the surface, that makes sense to some people. And then there's another group that's like, wait, what does food and birth have to necessarily do with one another? So I would say that for us within the collective and the people that the individuals that we support, one, being able to have the birth in the way that you want with the support that you want, right? So we talk a lot about comadres, right? And which is essentially the way that we like to use, the word that we like to use instead of doula, because of all the systemic ways that the systemic issues with the word doula, right? And it ties to enslavement and things like that. So comadres are the people who support you, right? Who have your back, who are willing to look out for you, who are willing to come and help you. So for us, that looks like meal trains. That looks like somebody coming to clean your house. That looks like somebody helping you find a lactation consultant. And then that's again where the food comes in. So actually outside of our offices, we have a garden, and the food justice work that we do is particularly important, but the elements, right? The actual plants in that garden are things that are supportive of our postpartum journey, right? So things that we can use to make teas, things that we can use to kind of help and heal our body And so once you can kind of have some level of, I don't even want to say control, but again, self-determination, once you can dictate what it is that you want, and you have all of those elements, you have the social connections and the social support, you have the food that you need, and you have that knowledge, right? Those practical skills, that you're on your way, you know, and that's something that we're doing right here in the city. That's you know, this idea of urban indigeneity, of how we're all doing this away from home, right? These are some of the ways to kind of maintain and revitalize those cultural practices that not all of us have, or our traditions that not all of us are aware of, right? But when we start to go through this process and we do it in community, you know, we wake those parts of ourselves up again. As far as the things that people should do when they're pregnant, rest, rest. I think begin to create those community relationships, those relationships with people that can support you, that you can ask questions of, and gosh, the third, I feel like I want to say, you know, beautiful things like, you know, start to ask questions and learn your traditions, learn your songs, you know, do those things, right? Because I think when that portal opens, and that's what it is, right? When that portal opens, you have access to so much more information. And also I think about it like feeding and nourishing both yourself and the spirit that you're carrying, right? Start to get connected, because you're going to inherently want to pass on some of that knowledge and information to your offspring. So start at that place, start being, and I think that's what happens when, you know, we're carrying life, we start wanting to be the best person that we can be. So just start, you know, supporting yourself, so that in those ways, so that you can carry on that knowledge to your child.
It's like great advice.
I'd like to add to that as well.
Yeah, sure.
From a health provider standpoint, it's good that they start prenatal care early. It'll help to establish their state of health from the get-go, and help to formulate a plan of care with the provider that's specialized just for her. Starting early also helps the provider to be able to pick up on any ominous physical or mental changes that may occur during pregnancy, as well as, especially with women of color, don't give up if she feels at any point that she's not being heard regarding her concerns. Ask for a second opinion, to speak with another provider or even a hospital supervisor, because as a patient, she has the right to report if she's not satisfied with the management of her care. There are also patient representatives in every hospital she can reach out to as well.
That's great information. Yeah, when I was trying to get pregnant, I was in France, and I started taking prenatal vitamins and all this stuff without ever talking to a doctor. I just thought that's a good thing to do. So I did it. And of course, I never ended up being able to have children because of endometriosis. But anyway, that you just kind of reminded me of that. I was trying to be proactive. So in 2016-17, the pregnancy mortality ratio for Indigenous women living in Arizona was 128.3 deaths per 100,000 live births, which is twice the rate of Hispanic or Latina women. In 2016 through 19, the rate of severe maternal morbidity for Indigenous women living in Arizona was 303 per 10,000 delivery hospitalizations, or 3.6 times the rate of non-Hispanic white women. So clearly the health disparities in Indigenous women are greater than other women of color or Caucasian women. Why would you say this is the case?
Just want to jump in really fast and say that, forgive me, I am needing to leave a little bit early today, and just close the circle and thank all of you for this conversation and for having me.
Thank you so much for being here.
Thank you.
So Stephanie, did you want to do, or
yeah, can I just actually respond to the former question first?
Sure.
And just in terms of, well, I think the ladies did an excellent job of defining self-determination, right? And I think Luella defined it perfectly. And so when you're in a healthcare setting, and I will use this example of our daughter, she was, when she was pregnant, she was being seen by a non-Indigenous provider, right? But thankfully her stepfather, my husband, Dr. John Molina, is a retired OBGYN and who happens to also have a law degree. And myself, just my background is mostly in the cultural knowledge that I know and that I've been blessed to have been raised with, within my nation. Oh, put us together and we make a force, especially whenever there's a system that we know. And so she delivered in Rapid City, South Dakota, her provider, non-Indigenous, and was actually encouraging our daughter to be induced. And so both of us just immediately, of course, John asks, is it medically necessary?
Yeah, why?
Yeah, and the doctor really couldn't say anything. It was just convenient for their schedules. And so John really flipped the script. I mean, I tell you, I've never seen my husband, and for anyone who knows Dr. John Molina,
I do.
yeah, you will never, I've never heard him cuss. The worst thing I've ever heard him say is rats. And that day he was very just on target. I actually tease him and I say, wow, I really seen your Apache blood show that day, because you were people think I'm the very territorial. I am very strong. I'm a very true Oglala. I am very direct. I'm unafraid to challenge these inequalities when I see them. And so, but he was very much in his face and he held every single provider accountable. And both of us together, one of the providers tried to present us with a research study that was conducting as a way to justify to induce our daughter, mind you, who at the time was 20 years old, and trying to justify by providing us a research study that had been conducted on young women in England. And oh my goodness, so talk about self-determination. I just reminded her whose land she's working in and that we are not, the women, the population she serves, especially the Lakota women or Indigenous women and women of color. She should not make that assumption and apply that practice across the spectrum. That is actually unethical practice, and it's inhumane. It's very racist. And so eventually she pulled herself from the delivery. And we basically, we were just very attentive, very alert. We were identifying every issue. John was monitoring. And I explained to her that, did you have any notion, or perhaps just were you inquisitive knowing that she had told you, that she was raised, in South Dakota, that she's Lakota, that give any inclination to ask her if she has any cultural beliefs or, spiritual beliefs that she would like to be incorporated into her birthing plan? And the provider said no. I had explained to the provider that you basically undermined the inalienable cultural and spiritual responsibilities of the Lakota, and that you, by not using free, prior, and informed consent, by not being culturally mindful of the population you're serving, you have just aided to the cultural annihilation of a human population. I said, we do not believe in any form of inducing. These Wakaija, these sacred little ones, they know when they are to come, and only if it's medically necessary do you, do you take such a practice. That is ethical, practice. So she ended up pulling herself, because we basically said, if anything happens, which everything that we was afraid of and John predicted happened. Baby, anyhow, just baby got mom's temp went up, babies, ended up
Stress.
fluid. Yeah, it was just, so she ended up pulling herself out. They brought in an older, very experienced OBGYN. They were prepping for an emergency C-section, and we told them directly, because everything that we had feared would happen, happened. And while we had 2-3 minutes at tops to pray, John prayed in Apache and Yaqui. I prayed in Lakota. We both prayed over her and our young Wakanja or Takoja. We sang our prayer songs and we were in tears. And then when the doctors came in the room, we wiped our tears and just put on our war paint, you know, and I said, Cheshnio, like prepare for battle, like wipe your tears. And this doctor comes in and he says, you know, you want to try? And within 3 minutes, 3 pushes, you know, there came our little, you know, Takoja Iwoblui. And we really taught that hospital lesson. We moved that, just that up the line. And that provider now was forced to take cultural competency. And so I'm actually working with the hospital to provide that, although we've always had a cultural advisor within that healthcare system, which is the second largest healthcare system in South Dakota. And I was just so distraught, you know, and I reminded the other provider, I said, please do not take my approach personally, but, you know, the cultural harm that you have imposed, you know, without taking into any consideration, you know, of outside of the spectrum of what you know or how you practice medicine, there's other ways. And the people that you're serving, you're in Lakota territory, recognize the lands who you dwell on. And so to fast forward to the traditional aspects of how women take care of themselves. We're taught not to go around death, not because it's taboo. And I think there's a lot of misconceptions. But from a Lakota perspective is that death brings about a lot of synergies, both good and bad. And that we know these young Wakainjas from the moment that they, you know, make their way from the Wichachwi Oyate, from the spirit world into, you know, greet each of the 5 grandmothers to the Toli, who is our grandmother who is in the Big Dipper. You know, she guides the young Wakainja into the womb of the human mother. And so we know that their energy is there. These metaphysical energies and elements that we know exist. And so this young one, these Wakainjas, we know that they're vulnerable. Their spirits are vulnerable. And we know that these human atrocities have been happening for, you know, since time immemorial, you know, that we are on bloodstained lands regardless. And so we have to be mindful. And so we do have our young ones carry sage or sweetgrass and just a few petals, you know, either in their shoes, their pockets, purses. I have them probably in every purse that I have, every laptop case. I do it with John, you know, just as a way, as a protective mechanism, because it wards off and it nullifies the energies. And when you're going around, you know, a wake or a funeral service, that brings about a lot of grief. And that grief is often very strong. And so there's people there that are just angry, they're distraught, they're emotionally just, I mean, you know, we all have gone through it. And that grief, you know, can be absorbed by the young Wakainja, you know, in their spiritual capacity. And then other things that we do is teach meditation, you know, and as, you know, most Indigenous peoples to wake before the sun, you know, to give our gratitude, to give our thanks for that day, to give, we call it our wopila, to make our offerings. And then also in the evening, because we understand that those are the 2 times where the metaphysical energies are at their strongest. And if you look at metaphysical energies and look at what NASA has discovered in hotspots, they actually confirm that those times of the day are when the Earth's magnetic core and the electromagnetic core that surrounds Mother Earth, the electromagnetic field, actually interact together and beyond every 7 to 11 minutes. And those are the strongest peaks are during those times of dawn and dusk. And so a lot of these pseudosciences really align with what we know as Indigenous peoples. And I can go on and on about just the different cultural type, you know, teachings that we endure, but I think those were probably the 2 most important ones. So I just wanted to get that out there.
Thank you. That's like, again, very interesting. You teach me something every time I speak to you or hear you speak. That kind of comes back to the thing that Luanna, you mentioned earlier about what's not in the literature. None of what Dr. Big Crow just said is in the literature, I'm assuming. Otherwise, this doctor might have known that there was another approach to treating her daughter. So We're running really short on time now. Such a rich conversation. Should have had you in the first panel too, Stephanie. But because this is sponsored by Save Our Schools Arizona, and I'm the Native American outreach for Save Our Schools, I want to bring it back to education. So in working with, because I asked this question during the first session last week, we talked a little bit about politics. Are there legislative efforts that could be made? Yeah, so in working with K-12 schools, how can our legislature here in Arizona or any other state support awareness, health awareness in public schools so that the students are aware of how to take care of themselves, the teachers, the school counselors, nurses know how to work with the students that they're in charge of, and then grow up having these great practices so that they can do the best that they can to determine their own healthcare, be engaged in their own healthcare, advocate for themselves. Is that something that the legislature could do, or are we talking about attacking these problems at different levels other than that? Luanna, what do you think?
Yeah, I believe it's something they can do. It's a lot of it is mandating certain policies to be, aligned with. But this is not my forte. Dr. Big Crow, anything you can contribute to this?
No, I definitely
we have Save Our Schools Arizona has two sides. They have the nonprofit and it says 501c3 and the 501c4. The C4 has more political, is more politically active and is in that realm. So I'm asking the question so that not only our audience can learn, but Save Our Schools people who are listening in can learn how we could help you advocate for better health.
And honestly, when I read that question, it made me very pleased. So Save Our Schools, thank you so much for just being very dynamic and, being able to ask this multidimensional question of theory, right? So my response would be, because right now we're dealing with a lot of this in South Dakota, we're proposing a bill that would look at the Indigenous health equality, and it's examining racism as an Indigenous social determinant of health. And because racism is such a word that, again, it's a trigger word, right? We really, our position is to nullify, again, those energies. We've all, I think, are just very overwhelmed emotionally, mentally, spiritually. And we want to nullify these energies between, mankind, if you will, human nature. It's just one of the issues that just seems to stick out like a sore thumb. And I always feel bad when we have to really look at that issue and examining it. But what that does for us is and I'm just kind of looking at our outline, there's a group of Indigenous women, Lakota women, that we actually served 13 years on the Parent Advisory Committee for Indian Ed. And we were actually able to move change and move policy, challenge some of the books that they were using, looking at, how it was just such an amazing experience that I think it led us into where we're at today now. And so we're working directly with the superintendent there in the Rapid City School District, and just wonderful, commitment and partnership to look beyond our own inadequacies, right, and our humanness, and to really place the well-being, the mental, physical, and spiritual well-being of our children, not just Indigenous, but all children. Because if you can imagine what our Indigenous children have gone through, then we must be considerate and mindful of what the non-Indigenous have gone through. We're only up against 2 centuries of attempted genocide of a human population. Non-Indigenous are up against how many centuries? That we don't know. So I was always taught, pray for them as much as we pray for us, protect them as much as we would protect our own. And I do, regardless of, ethnicity or background, all children are innocent. And so when we looked at examining racism as an Indigenous social determinant of health, we understood that that would actually be able to identify, and using, this, oh gosh, it's a theory I used in my dissertation, but just to identify these commonalities, right? So what are some of the themes that are being shown throughout the research? And we're working with the urban Indian population to see, and that was actually what has always come out, is that examining racism as a social determinant, because many of our school educators don't understand. Many of them don't really have insight or influence of what it's like to have been raised on an Indian reservation. I myself being raised on an Indian reservation, we don't question, we're taught to be grateful for the healthcare. So it's almost as though our own virtues have worked against us. So when we looked at examining racism as an Indigenous social determinant of health, we understood that if we could identify how that impacts the emotional, just the emotional, state of being of our youth held up in these non-Indigenous, educational systems that are European influenced, and the standardized testing, that encompasses both the mental, the psychological, and the spiritual, because we are not linear thinkers. And there's a vast difference between, and my husband and myself are prime examples. And Nadine, I think that you know well enough now to know that we are very different in the way that we think. And the conundrum there, or the interesting fact there, is that he was raised in an urban area to where he was exposed to progress as defined by Western ideals. Whereas I was raised on an Indian reservation for, the first half of my life and educated within the Bureau of Indian Education, where I was in special education classes, the first part of my, I think up until 7th grade.
Makes no sense.
And it was sad because that's what they're seeing, but they only did what they thought was best, right? But when we start providing these policies and laws and looking at examining racism as an Indigenous social determinant to health and how it impacts the emotional, the physical, and the spiritual of that child, we can start really changing the curriculum within school systems statewide or system-wide, which would be beneficial for not just the child, but all involved, all key actors.
Exactly. I agree. I couldn't agree more. And that I feel like I'm doing something right through SunClam, because those are the kinds of approaches that we take. As you know, we've had long discussions about that. I wish we had more time. I didn't get to all the questions. Ironically, I was afraid I was going to run out of questions, which, but I didn't, because you have great insight, great information to share, great experience to share as well. And so I think that maybe we should do another session somewhere down the line, get to some of these other questions. But before we go, I want to remind everybody that our next Indigenous Perspective session is October 12th. And the subject is how state legislation impacts Indigenous people in Arizona. And we're going to have 3 legislators. We're going to have Senator Peshlakai, Representative, I just went blank, Germain. I know she has a hyphen in there, and Representative, help me, Kate.
It's Jasmine Blackwater Nygren.
Thank you, Blackwater Nygren. I've had a brain fart. Excuse me. It happens to the best of us. Thank you. So we've got a couple of minutes left. Let me see if I have a short question. Oh, wait, and Luanna, she'll remember the long question that we had last time from one of our viewers, and we still didn't get to that one, but she's an education professor at Eastern Michigan University, and she was asking about preparing her students who, they're pre-service teachers, to work with work with Indigenous students, parents, families when they are actually in the classroom, and perhaps working on a reservation or in maybe an urban setting with a significant number of students who are Indigenous. And the advice that Frederica gave her was to teach with humility, to approach every situation with humility. Is there anything in 30 seconds each that you would like to add to that?
I agree. Just teach with humility. Don't make assumptions. Don't look at the child in the humanness in the physical form, or just a number of, within the class or the cohort that you're educating, but look at the spirit, the soul of that child, and try to your best to understand and see, what that life journey has looked like or has been like for that child. Because somewhere down the line, if not only did we inherit it, but because of these social determinants, we have a lot of broken families and a lot of violence. And so when you see the broken spirits in these young ones, nurture that first before trying to educate, because both will align eventually and you will empower them.
Wonderful. Thank you so much. Luanna?
Well, I know they mentioned about radical equity, and I had come across a protocol. The acronym is PRESS, and it stands for, it's different stages for an organization when you're trying to promote radical equity within the organization. And the first one is personal and problem awareness. Second one is to determine the root cause analysis. Third one is to promote empathy or level of concern about the problem and the people it afflicts. Fourth is to develop joint strategies for addressing the problem. And fifth is to sacrifice or willingness to invest time, energy, and resources necessary for strategic implementation. So organizations going through these stages move from understanding the underlying condition to developing genuine concern to then focus on correction. And that gets them engaged.
Very good. Again, I feel good about what SunClan is doing, because that is a lot of what our curriculum does, is to work with educators, administrators, counselors, everybody who is an Indian education stakeholder. We work to do exactly the things that you're talking about. So thank you so much. This hour went by like that.
No, and thank you, Nadine.
Yes.
I want to thank you for continuing this, your passion and dedication. I'm very grateful for your work. We need more of it. If we could just propel you on every screen in America and the forums that you have held, you've really done a wonderful job of bringing together these two contemporary worlds, that are vastly different. So I really have to thank you for that. And I support your work in every which way. And if there's anything that, John and I can do, that we always support you and respect you wholeheartedly. So
Thank you so much. The feeling is
I second that motion.
Thank you both. Thank you, Luanna. Well, that's it for tonight. So join us on October 12th and be well. Thank you.
well,
Thank you.
okay, everyone.